Hey, I'm doing a sound check, and somebody tell me whether or not they can hear me.
Yep, you're good.
Loud and clear.
Thank you.
Oh, it's.
So she like cries over it. You don't do that. You do this. I was like, oh.
Good morning, everybody. I'm gonna go ahead and pass it on to Dr. Howard. We have retirement, and Dr. Howard, if you can take it.
Good morning, everybody. This is a bittersweet morning for me. Ninni Jacobs has been our radiation safety officer for the last 7.5 years. And during that time has done stellar work. She had planned on retiring in August of 2019. And because the skill set that she brings to the job is very difficult to replicate in candidates for that position, she very graciously agreed to stay on until we successfully recruited her successor. Then the pandemic came and everything else became very complicated. And so it's been now almost 2 years since Ninni first told us that she was planning on retiring, and she has remained with us during that entire time. And for that, the organization generally and I personally are very grateful. While she's been here, Ninni has done a lot of things that most of us don't even think about on a day-to-day basis that have helped us remain safe and functional as an organization. She updated and improved fluoroscopy safety and laser safety training. She removed some decades-old radiation safety hazards that were in the building. She brought a new kind of safety to our trash compactors. She initiated and brought to completion a collaboration with the Cleveland VA to allow us to perform dose monitoring and radiology in a much more robust way. She led the process of improving how we manage our lead-based PPE for inventory and inspection. And then the biggie is that she did the licensing and shielding evaluation for the TrueBeam linear accelerator in radiation therapy, which has been a major upgrade in our capacity to care for cancer patients with radiation therapy. So Ninni, this is a certificate of retirement for you that you can carry off to Rhode Island with you. Ninni has, in the best tradition of the way she does her job, agreed to help us out in the transition with Dr. Holfeltz, who is her successor as radiation safety officer. And Ninni, thank you very much, and we appreciate it. And we hope you have a great time in retirement.
Thank you. Just want to thank everybody for the opportunity to work here and to serve our veterans. I thank Dr. Howard and Director Delancey and Mr. Lubriel and everyone in the front office and all my colleagues who I worked with. And I especially like to thank everybody in the basement who's been a big source of support for me. Whatever I needed, they were always there to help me. And I have lots of friends in the basement. So I really enjoyed working here and I thank everybody. Thank you.
Okay.
All right, congratulations, Ninni.
Thank you.
Best of luck.
Thank you.
Take care. Okay, so you have a lot of congratulated notes on the chat, so enjoy your retirement, Ninni.
Thank you.
Take care. All right, so how about some census on this beautiful Friday morning?
Good morning, this is Dory covering for Amy. ICU, we have one patient who is comfort care. 7B, 16 patients with 2 to 3 anticipated discharges. 8B, 16 patients. Again, they're thinking 2 to 3 discharges are possible. 9B has 23. 9C with 24. 10B has 6 patients. One that was admitted yesterday for detox did have a code blue and was sent to 7B. And he's on a 1-to-1. SARP has a census of 2, no admissions, no discharges, and that's about it.
Dory, it's Sean. Is there still one COVID positive on 7B?
I believe he was discharged.
Okay, I'll check. Thank you.
Okay.
Okay. Thank you. Dr. Howard.
Yeah, I have a couple of things this morning. One is to just mention that the last 2 days, the Surgical Summit has been happening here in Albany. This is an event that was canceled last year because of COVID, but has been held for a number of years previously, where the chief and assistant chief from the National Surgery Office come to each VISN, and all of the pentads or quads of the VISNs, along with the chiefs of surgery of all of the VISN members, get together and look at opportunities to improve surgical programs individually and as a group. Dr. Lupinetti presented the information about our program and did a great job. And we, like everybody else in the VISN, have some opportunities for improvement, which are well on their way to fruition. But in listening to some of the challenges and opportunities that other programs have around the VISN, I was reminded yet again of the fact that Albany rocks. And so my congratulations to Dr. Lupinetti and her entire team in the OR. The other thing I wanted to mention was sort of a daily update on the situation with COVID, locally and nationally. The Delta variant continues to aggressively spread around the country, and we are learning more and more about it. You'll be hearing some more from me and Dr. Carlin and Christine Gagnon over the next week or so to update you on it. But just suffice it to say that it's becoming increasingly clear that the Delta variant, which is now the variant found in about 80% of individuals hospitalized with COVID in the United States, is much more contagious. And we're beginning to understand that in unvaccinated individuals has a much greater virulence than the native COVID virus, which was unleashed back in early 2020. Its virulence is dramatically diminished by vaccination. And so this is why the push for vaccination among unvaccinated individuals. The other thing worth mentioning is that we're a little concerned both locally and nationally that we have let our guard down to some extent. And we've had a couple of experiences here in our organization of people coming to work with what they think is, quote, just a cold, who, when all is said and done, turn out to be unvaccinated individuals with the Delta variant. So that I would plead with everybody who works here to remember that You should not come to work if you do not feel well. And that doesn't mean don't come to work if you have 103 fever and can't get out of bed. That means if you have the sniffles or a little cough, don't come to work and get yourself tested. The risk is real, and we appreciate everybody taking the effort to protect our veteran patients, our coworkers, and our colleagues. That's all I got, Gino.
Thank you, Dr. Howard. Dr. Pellerin.
Morning, Chino. I have nothing.
Thank you. Ops Group.
Good morning, Chino. This is Eric down in safety. I just want to let everyone know we do have a major crane lift going on Monday. The contractor will be here on Sunday to prep for it. This is for the grease trap between building 26 and 27 in the main building. This will not affect any patient care with nuclear med or radiation therapy. There'll be a flagger that will assist patients parking and back out. There'll be police and Eric Adams have no traffic through signs placed near the ED circle, and they'll be helping flag people down that need to go to radiation safety, so it won't affect them. There is an ILSM going to be in place, and there should be no impacts to the kitchen. There will be no through traffic going around to the back of to logistics to the loading docks, but you'll have to follow the signage, and please keep in mind that the crane will be lifting. It is a major lift, so we're just going to be careful with it around back there on Monday. Any questions on that?
Yes, I have a couple of requests. We didn't see a plan in writing. Can you please send the PANTAT a written plan of the operations for Monday so we are fully aware and how we can assist you further in getting that job there done?
I will get with FMS and make sure they have it that way. All right.
Thank you. Appreciate it.
No problem.
Anyone else from the Ops Group? Everyone at large.
Is
Morning,
Mike?
Chino.
Go ahead.
Go ahead. I was just going to head to the safety story, but go ahead,
I
Dr.
was going to ask if Mike Fitzpatrick is on from Voluntary Services.
Yes, I am on, Dr. Howard.
Could you give us an update and maybe a little plug for the food collection that's going on?
Absolutely. So that is the Feds Feed Families Food Drive that's going on. We appreciate the support, certainly, that we've already gotten. It's actually been quite great. Through the first couple of days, we've already been down there with our carts to pick things up. So this is, you can, bring in any canned goods, boxed goods, any of those shelf-stable items, including shelf-stable milks, if you're able to get those. And those come right up to our food pantry here on 9 Delta and go out to our veterans. And also, if anyone, is up this way or around and you want to take a look at what we've got up here, please, by all means, stop by. We're glad to show this off. We're very proud of the food pantry we have here. It's grown a lot over the years.
Yeah, food insecurity is real among our veteran population or some segments of it, and this is a very important drive. But emphasize that we do not have refrigeration capacity in this endeavor, so don't bring in the leftovers from last night's supper, but bring in things that are new, unopened, and don't require refrigeration.
Yes, and again, thank you, everybody.
Yeah.
Thank you.
Kirsten, you want
got
to
a
do
safety story?
Yeah, so I actually have 2 HRO things this morning. One is that earlier this week, Dr. Patel and I were invited to present the CLC antigen testing project at the National Systems Redesign Call. And we have since gotten an email back from the Associate Director of Systems Improvement stating that many facilities can use the lessons learned from that project. So I just wanted to thank Dr. Patel, the CLC staff, OC Health, and infection prevention for helping with that project. And then for the safety story this morning. So this is a really nice story. It definitely is all about the veteran, but it's also about making sure that folks are asking questions and kind of getting to the root of what it is that's going on. So this morning's story is out of quality. So Marlene, are you there?
I am. Good morning. So this example came, or safety story came last Friday. There was a veteran that came down the quality management hallway asking for help. The veteran stated he was a Boston VA patient, needed prescriptions filled as he was traveling in his RV. The veteran stated, I went to medical records and the pharmacy. They stated they could help. They couldn't help me because I wasn't in the system. So for the action, the QM staff took his information and contacted the traveling veteran coordinator and PAC nurse management. While this was occurring, the QM manager heard the veteran stating that he was leaving to go to the emergency room. The veteran was asked why he was going to the ER, as we asked him to be patient with us while we are having the traveling vet coordinator access his record. When the veteran was asked why he was going to the ER, the veteran stated that he called the patient advocate and they stated go to the emergency room. The veteran stayed with the QM staff and was contacted by the traveling veteran coordinator. The PAC nurse manager contacted the business office to get the patient registered. And then the traveling veteran coordinator contacted pharmacy to get the patient his cholesterol medication. And the ambulatory care chief nurse brought the patient to the pharmacy to receive his medication. So as a result, the patient received medication. And I just want to say thank you to Melissa Sequina, Tom Davidonis, Grace and Karen, and Stacy Mapston for their help with this veteran. So he was up here wandering in our hallway, just asking for help. So it's just some information we need to give to the staff about maybe our traveling veteran program and where to bring the veteran where he needs to go, instead of just stopping to say that we can't help, always trying to help and make sure that it is always about the veteran.
Thank you. Nice story. Anybody else? Okay. With that, I yield back. Enjoy the rest of your day. Happy Friday and have a safe and joyful weekend. Take care.